Yeah, Bushra Saleem, you can start now.
Yes. Okay, sir. Good morning.
Good
My
morning,
name is
nurse.
Bushra. Okay, my name is Bushra, one of the registered nurse in this clinic. What's bring you here?
Yeah, actually, the doctor recommended me to meet you and have a discussion regarding self injecting insulin. That's why I am
Mm-hmm.
here, nurse. My name is Abraham Lincoln, and you can call me Mr. Lincoln. I am 60
Okay.
years old.
Okay, Mr. Lincoln. Could you please tell me what do you feel about the use of the injection?
Yeah, actually, I have a concern. I have
Uh,
been managing my diabetes well till now for the last 3.5 years. I have no
okay.
problem at all. But why
Mm-hmm.
did the doctor suggest me to change my treatment plan? I don't understand. Yeah, of course, there was a test and he said something. I was not very clear about it.
Mm-hmm.
Can you tell me the reason,
Yeah.
please?
Yeah, sure. Your concern is understandable, Mr. Lincoln. But before we proceed, I would like to tell you why the doctor decided to switch from tablet to the injection. As you are aware, your diabetes, you are having a diabetes, and you were on oral hypoglycemic medicine, which was not able to control blood sugar level. So now he decided to switch from the tablet to the injection, which is the faster effect on the blood sugar, so it will control. Is that clear to you?
Yeah, that's absolutely fine, nurse. And yeah, that's okay. I understand. But is there no other way to manage my diabetes other than these insulin injections?
Yes, Mr. Lincoln, I can understand your concern. Actually, this is why we shifted, as I told you earlier, because we need to, the injection is a very faster effect on the blood, and which is cannot control your oral hypoglycemic medicine. So this is necessary to start your insulin injection for what your doctor has sent to you here in this clinic. Is
Okay.
this clear to
Yeah,
you?
if actually I am afraid of injections, I don't really like the thought of injecting myself. I don't think I'll be able to do it, nurse.
I understand, Mr. Lincoln, your concern actually. But I would give you the some instruction and guidance. So if you can follow this instruction, you would be able to inject yourself. So would you allow me to tell you how to
Yeah, please go ahead, nurse.
Okay, thank you for letting me know. And then let me explain you first. The insulin injection is very important. As I told you earlier, the insulin injection will absorb into the blood faster than the oral medicine. So first, what we have to do, that we have to wash our hands. So this is the first and most important thing. You have to wash your hands and then pinch your skin and with the dry hands and insert the needle 45 to 90-degree angle. And leave then when you inject the insulin, leave that needle till 5 to 10 seconds. So the medicine can be absorbed there. Okay, is that clear to you?
Yeah, that's absolutely clear, nurse. And okay, what are the different sites for taking these injections? And should I use the same syringe and needle every day? Will there be any
Yeah, that is
complications?
a very good question. I would explain you regarding that. You know how you have to follow my instruction, and but remember each time you have to rotate your site of the injection site. Why? Because there is a chance to formation of lump, and there is a risk of insulin less absorption of the insulin injection if you inject at the same site each time. So you have to rotate the site of the injection. Did you get my point?
Yeah, of course, nurse. That's very clear. And now, what should I do with these used needles and syringes?
Yeah. That is the last but not the least question, and this is very important to know. Always you have to dispose the needle. You know, the needle is it is sharp, and we have to dispose properly. If you have a one, you can have a one box, and each time, whenever you use directly without capping your needle, you have to throw on the bottle, and then. And other important thing is the for the insulin storage. You have to keep the insulin in your refrigerator because if you keep outside, the medicine is there having on efficacy. So if you keep outside, so it will affect on the that is a potential harm for yourself. So if you inject that medicine, is that clear? You getting my
Yeah,
point?
that's absolutely clear, nurse. And are there
And
any
before,
negative effects or side effects or after effects of these injections, like itching
yes.
or burning or swelling or anything like that? Are there any
Actually, for the
possibilities?
yes, actually, all medicine having their side effect. For this, there is not dangerous side effect, but if sometimes some people they feel rashes or itching, you have to notify immediately to your nearest center. You have to come. But before you inject, some precautions you have to take, which are you have to check the expiry date of the bottle, and as I told you, to avoid in the sunlight and high temperature, you have to keep in the refrigerator to maintain the efficacy of the medicine. So this instruction you have to follow. Is this clear to you, Mr. Lincoln?
Yes, of course, nurse. That's quite obvious and clear. Okay, then. Thank you very much. Now, what I want you to do is, okay, I will take the injection now. You please monitor. I'm ready.
Mm-hmm.
So I'll give you myself an injection and you can watch me doing this. And if there is any need, just please interrupt and
Mm-hmm.
suggest me. Slowly, I'll follow it up.
Yes. Okay, sure. Thank you, Mr. Lincoln.
Thank you very much, nurse, for your kindness. Yeah. So now let me give you the
Great.
suggestions. Okay. Let me give you
Yes.
the suggestions. Where is this?
Yeah.
Yeah. So, right. Yeah. So let me give you some suggestions. Um, First and foremost,
Mm-hmm.
I have to congratulate you. This is your first speaking session with me, but you are doing well. There is not much problem as you have a lot of experience in nursing, so there is no problem because the subject matter you know, how to deal with the situation you know, everything you know. So there is no problem. Only the thing is English. That's it. So
Mm-hmm.
now I'm telling all this. Afterwards, you can go to the YouTube and you can see these suggestions and you can make them, note down these points, and you can
Okay.
practice on a regular basis. Now be silent and just listen until I tell you. So
Mm.
you can mute your
Okay.
audio. You can mute your audio.
Yes.
First thing is you are saying you're opening your mouth and just letting out some sound. This is sound. This is sound. So unnecessary sound we call it. It's unintentional, meaningless, and useless. There is no practical benefit of this sound. Uh, uh, if you say means okay, means I agree. So oh means is that so? Ow means I'm sorry. Okay, means I'm in pain. So these are meaningful sounds. When you are making these sounds, there is some meaning, there is a message. So you can make such sounds with the intention. Intentionally you make these sounds, they are accepted, but unintentionally you are helpless, you don't know something to do, you're just opening your mouth to say something and you're left with nothing, and you make some sounds, so that is called unnecessary sound. Avoid this. Next step. The second point is you would be, you would be. So you said you would be and stopped there, and again you started you would be. So why don't you continue from there itself? Why do you want to repeat the already uttered phrase? You already said you would be. You know that you have said you would be. Then again, why do you want to start from you would be? So avoid a repetition. This is not the first time. 2 or 3 times you have done like that. Then I had already noted the point, so I did not. So you'll say something, 2 3 words, and stop, and again start from the beginning. That's the problem. So you did not forget that you have already told. So remember that one and continue from where you have stopped. That's it. Then third one is you. I will tell you. You should. Let me explain. Me. I will tell you. Okay. I will tell you. So I will explain you. This I, you, me. All these things avoid as far as possible. I'm not telling don't use. That is not wrong. That's correct. But the point is, you're using personalization here. This is a formal session, and you are diluting the quality with personal pronouns. I will explain you. Why I? Why you? Or let me explain you. Why me? Why you? Can't you say without this I and you? Why do you want to give that personal touch? Do you think that only you are the person in the world who can explain insulin injections to him? Definitely not. Any other nurse can explain. Any other nurse can explain. So, what's the great deal in that? I will explain you. That means if you don't explain, there is nobody else in the world to explain him. So that means I is not important. Then why are you bringing I will explain you? Eh? Are you big boss here? No, no. So are you want to boast about yourself that I am great? No, there is no need. No need to bring this I here because I is not important. Any nurse can do this. So what's so special about it? So there is nothing special. So avoid it. So you can say like this. The procedure for self-injecting insulin will be explained. The procedure for self-injecting insulin will be explained. The area where the injection should be taken should be selected. The location should be cleaned with a cotton swab. There is no I, there is no we, there is no you. So this is the way how you can speak. There is no problem. Just see here what is important. I is important, you is important, or insulin injections is important. Which is important? Okay. You, I am suggesting you, I am suggesting you to dispose the used sharp instruments and needles, syringes, and glass vials, broken glass vials into this disposable container. Why should you say, I am suggesting you? Or why should you say, you should dispose? Just what is important here? All the used sharp instruments, such as needles, syringes, the injection vials, should be disposed in this blue disposable container. Then you should secure the lid tightly. Why you? The lid should be secured tightly. So what is important? You is important or the lid is important here? You're talking about you or you're talking about a lid? Okay. You should exchange this container with a new one when it is 3/4 filled. Why you? Why you? This container should be deposited at the pharmacy or the hospital, and a new container should be taken once it is 3/4 filled. Don't wait till it is 100% full. Okay, so there is no you, there is no I, there is no me. Avoid as far as possible. They're not mistakes. You can use. You can definitely use. There is no problem. That the quality is low grade quality. Okay. The more you personalize, the less it becomes formal. The less you personalize, the more it becomes formal. So you're going to informal or formal. Okay. Right. Remember that. The next one, hesitation. There was one instance where you were silent for almost 10, maybe 12 seconds. Silent. You did not know what to do. So there, instead of being silent, you can use some fillers. Some fillers can be used. What are these fillers? Of course, that's quite understandable. I absolutely agree with your points. It's a very good proposition. The information will be provided to you. So these are some fillers. Write down some fillers like this, and on the spot you can use them. And by that time you'll get the idea, and you can continue with that idea. So write down some sentences which are quite common. When you are confused, suddenly you can use those sentences. That is a very important point. I absolutely agree with your concern. There is nothing to be worried about this particular procedure. I will explain you some steps. So this, I will explain you some steps, some measures. So you can change it like this. Some important measures will be explained beforehand or in advance. So write down some sentences and just put them into your brains, so that when you are in such a situation, you can use that. Then those 10 seconds will be used properly. So the other person will not even know that, but he knows that you are managing the situation very well. The next one, confusion. You are in between, you are in a juxtaposition, means confused whether to say this or that. I will, you should, something. Okay, both are okay. This I will or you should, both are no need. What do you want to say? What exactly you want to say? So why are you using I will? Then you are changing to you should. What exactly? Are you talking about yourself? Are you talking about the patient? No, don't. Don't talk about yourself. Don't talk about the patient. When you beat around the bush, then you'll get confused like this. So what exactly about what you want to speak? That you have to understand. Care. You should be careful, and you should not leave the materials, there's a sharp instruments anywhere, because kids are there. They may get pricks, needle prick injuries. So what you want to say here? I'm telling you, listen very carefully. Don't, you should not. All this no need. There is a possibility of needle prick injury. There is a possibility of needle prick injuries in case these sharp instruments are carelessly left around you. Therefore, disposing these sharp instruments and the broken glass pieces should be disposed into the container immediately after use. To avoid any unforeseen complications that may arise in the future. Remember, prevention is better than cure. The next one, idea generation. First, you should have an idea. Then you have to develop that flow of thought. You have an idea what you are talking about. Then you have to first word sentence, next word sentence, next word sentence, order. The flow of thought. First, idea generation. You generate an idea, then you will proceed with the sentences. That's called flow of thought. Yeah, your fluency is okay, no problem with this one. Then you said this instruction. This instruction. Did you give only one instruction? You can say these instructions or the instructions should be implemented with the body, mind, and spirit. Compliance with the medication is extremely important for managing your blood sugar levels properly. Non-compliance to self-injecting insulin on a regular daily basis, as recommended by the medical practitioner, would result in negative situations or deteriorating health standards. So you can speak a lot of things. Only the thing is, you have to speak. Okay, right. So this information, or these instructions or the instructions, plural. You will not give only one instruction here, right? You have given many. So you can say the instructions or these instructions. I hope you understood very clearly. Now you can unmute, okay? And you can speak whatever you want.
I got it, sir. But I have a one question.
Yes.
I didn't. You told me we should not personalize that.
Uh-uh.
So how we can? We should not be personalizing. I and you and me. We should not start.
Hmm.
So how we can initiate the conversation? If
Okay.
how
That
we
is
can
correct
reassure
only.
because
I am not saying
yeah,
it is wrong. It is correct
yeah, yeah.
only. But every time every time you, every time
Mm-hmm.
we is not a very good thing. Okay. Now, what you want to tell,
Okay.
you tell me one sentence.
Like
You tell me any
so,
sentence you want to speak. Any one particular sentence.
okay, I understand your concern, but let me explain
I
you. This is the
understand your
first.
concern. Let me
Okay.
explain something. Two sentences you have
Mm-hmm.
said. Okay, let me take first sentence. I
Okay.
understand your concern.
Mm-hmm.
Why only you can understand his concerns? I'm asking you. If some other nurse is there, can he or she not understand? So
Okay,
you are
right
not doing
now I
something
am
great,
talking.
right? So I understand your
Mm-hmm.
concerns. Instead of saying
Mm-hmm.
I understand your concerns, I, you, concerns. Which is important in these three things? I is important, or you is important, or concerns are important. About what you are talking? You are talking about you, or you are talking about the patient, or you are talking about the concerns? What is more important? What is newly introduced in this sentence?
Patient.
Huh?
Patient concern.
Patient,
Patient concern.
patient, no, concerns are important here.
Yeah.
Correct? Patient is already,
Yes.
you know, right?
Yes.
Even before the
Yes.
sentence, you know the patient, right?
Yeah. Yeah.
Newly
Yes.
introduced point is concern. Yes or no?
Yes.
So the concerns, the expressed concerns are extremely important.
Yes, sir.
The concerns are obviously reasonable. Okay.
Okay.
The concerns are extremely reasonable.
Yes, sir.
Okay. So you can say, nah, there is
Mm.
no, I, let me explain. The explanation will be provided. Let me explain you regarding injections. Explanation will be provided regarding the
Yes. Yes.
injections. Is that clear now?
Okay. Yeah. Yeah.
So what new thing you are introducing, start with that big thing, because that is the king of the sentence. Is that clear?
Okay, sir. Yes, sir.
You write down some 10 sentences and then change them into passive voice. Then you
Mm-hmm.
send them to me. Okay. I will correct them and I'll give them to you. Is that clear? Yeah.
Yes, sir.
Now you tell me, how was the session? Did you get any benefit? What do you learn? Yeah, you have 1 minute now.
A lot of things I have learned today. This is my first time like this session
Mm.
I've been. So I have learned a lot, sir. Because before
Yeah.
I was using this let me explain and some few sentences. So now I got a point. We can more modify our. I can speak. Next session will be some changes.
Yeah, very good, very good. Thank you very much. And you can write,
Thank you,
you are a
sir.
regular student now, and you can write one letter and you can submit me.
Okay.
Okay, when you are comfortable, manage your
Mm,
things and then submit me. Every day you have to do. I will not call you. Okay. Remember, you are my
yeah.
student, you are my child. Okay. Your
Yeah.
responsibility is on my shoulders, but I will not be behind you. Okay, because
I will be behind
these are
you.
online
I will
classes.
not
So
leave
what?
you.
No, these are online
Yes.
classes. So you have
Mm,
to be behind me. Whenever you are free,
yes.
sir, I am free now. What should I do? Enough. I
Mm,
will respond.
sure.
Because you
Thank
are
you so
in the
much.
other part of the globe, somewhere in the Middle East, and
Yeah.
I am here in India, and it's very difficult to manage the timings, and everyone cannot come together. So
Yes,
these are
sir.
personal sessions. So
Yes, sir.
you paid the fees, you
Yeah.
deserve the classes, you deserve quality. So I am there for you. But only the thing is, you have to tell me, hello, sir, or good morning, sir.
Yes, sir.
I came back from duty, or I'm going to duty. I'll be available at this time. Sir, now I am free. I will be free from 10 to 12. Something like that. You send a message, na? Then I'll be, oh, this girl is very studious. This girl is behind me. So I should do something for her. Otherwise, I'll forget,
We
right?
will see like that. Yes,
Is
sir.
that clear?
I have to.
Are you
Yes,
comfortable
sure.
with me?
Yes. I'm
Yes.
happy because this is the first time
Mm,
this feedback I'm having.
mm.
The twice I will say I hired and he was teaching me, but he said, "Okay, I am okay, I'm good like this." But I was not comfortable. I'm not getting. Still, I was not confident. That is why when I saw your videos, so
Yeah, he was
immediately I
right.
messaged.
What he said, he was right. You are okay.
Mm,
You are okay. He is okay. Your marks are okay. Everything is okay. It's not excellent. It's not extraordinary. It's not wonderful. It's not marvelous or amazing, right?
but
Because the
I'm
student
not
is okay, the subject is okay, the teacher is okay, the preparation is okay, the marks are okay. Okay means what? Average, something like 300 to 350. You understand?
mm, yeah,
If it is excellent, you'll get more than 350, 400 like that, right? You understand?
yeah,
See, because See, I am an English language specialist. If you go to a nurse and teach, ask her to teach, they will teach like that only, because they are nurses. They are not professional teachers, right? They have some crude knowledge. They have some basic knowledge. Based on that one, they will teach
Yeah.
what they know.
Yes, sir.
If you ask them how to do nursing and all these things, they will tell excellently, because they have
Yes, sir.
4 years a degree. Correct. If you ask me to teach nursing, how can I? If I ask me to do nursing, I
Yeah.
cannot do, right? That's the difference between a nurse who is teaching English and a teacher who is
Yes,
teaching
sir.
English. It's like
Absolutely.
that a teacher doing nursing, how it will be the same way
Yeah.
it will be nurse who is teaching English. Correct or
Mm-hmm.
not? You cannot expect a quality from a nurse
Yes.
who is teaching English, and you cannot expect a quality from a teacher who is practicing nursing. Yes or no?
Yes, sir.
It is dangerous. If I do nursing, it is dangerous for the patient, because I'm not
Yes,
trained.
sir.
In the same way, it will be dangerous for a
Mm-hmm.
nurse to teach a patient, a student. You got it, the point?
Yes, sir.
That's why people are failing. Nah? It's
Yeah.
already danger. You're in the danger zone. Danger zone doesn't
Yeah.
mean the death, getting disease only. No, you are in the danger zone. You're facing
Mm-hmm.
failure. You're facing difficulty. You're not getting marks. You're troubling. You're wasting your time. You're getting mental tension. This is all danger only. Nah?
No, I was in depression.
I think you got the clarity of your meaning. First time I got this words. Any teacher,
From
English teacher,
devastated.
professional English teacher can teach you. Okay.
Mm,
Nursing subject,
yeah.
that is normal. Anybody can, that's different thing. We are not doing nursing. We
Mm,
are doing learning English. Okay. Right. So
okay.
fine. Very good. At least there is some difference. Now you target 400 plus. Don't cry for 350. Don't beg for
Okay, sir.
350. Dance,
Okay,
dance for
sir.
400 plus.
Mm,
Okay.